Greetings, everyone. Today, we'll talk about the skeletal system. Some of the things you'll learn today are the functions of the bone, the divisions of the skeleton, which consist of the axial skeleton, the appendicular skeleton, and then that includes the upper and lower extremities. We'll start with the background of the skeletal system. It consists of two types of connective tissue, one being cartilage that's found in babies, and it continues to exist in the nose, outer ear, voice box, and at points where the bones attach to one another. The next would be the bones, which are found in adults only, and it contains functional cells called osteocytes. It also contains intercellular material which become hardened by the deposition of mineral salts and calciums and continues throughout the years until the bones fully develop into adulthood. This process of bone formation is called ossification, and they repair themselves throughout life. So let's give an example of newborn babies. When you have a baby or when you see a newborn baby, you often hear the adults or people say don't touch their head, or the doctors will say don't do much to their head, don't brush it, don't put a lot of force on it. And it's because it's cartilage, which is soft. Now, as the baby begins to grow, the cartilage turns into bone, and that's why it's found in adults only. In addition to that, where it says repair themselves throughout life, if you break a bone, your bone, it repairs itself. You don't have to do anything to it unless it's major or the doctor has surgery, but in essence, the bone will repair itself. Now we'll talk about the structures of the bone. We have the compact bone, which is the outer layer or shell of a bone. It's dense in nature and it contains an intricate structural arrangement of circular rings of tissue containing bone cells, hardened intercellular substances, and numerous minute canals for blood vessels called Haversian systems. And we'll see the differences. Now we also have a cancellous bone, which is the inner part of a bone, and it's spongy or porous in nature. So here we see spongy. It contains spaces occupied by the red bone marrow, which is responsible for the manufacture of red blood cells in the body. And we know red blood cells give you oxygen. And it's covered with a tough outer membrane called the periosteum. And you'll see it here. Now we'll continue to talk about the cancellous bone. You have the diaphysis, and it's the shaft, the epiphysis, end of the bones, the articular cartilage, which covers and cushions the end of the bones where they form a joint. You will see that here. And the medullary cavity, which contains yellow bone marrow. Now we'll continue to talk about the 5 functions of the bone. Those functions are to support, protect, provide movement, provide storage, and provide hemopoiesis. Support, it's rigidity to the soft tissues of the body to maintain posture. So you're able to stand up, you're able to sit up, and that's the support of your bones allowing you to do that, maintain your posture. Provide protection to help protect the organs, for example, the brain and the internal organs. Provide movement, which serves as points of attachments for the body's muscles that pull on the bones, resulting in movement. And provide storage. It stores minerals in the body for calcium. And it's important to note that calcium, when blood levels rise above normal, the calcium moves into the bones, and when they fall, the calcium levels fall, it leaves the body and enter the bloodstream to be used throughout the body. Remember, red blood cells are for oxygen. We also provide hemopoiesis, which is to make blood. Blood cells production occurs in the red bone marrow of the body. Now we'll talk about the divisions of the skeleton. You have the axial, the appendicular, but in addition to that, we'll talk about classified bones, and those are the bones which are always present in the normal human body, and there are 206 of those. That's an important number, 206 bones. Then you have unclassified bones or sutural bones. They're small chip-like pieces of bone, sometimes found embedded between the cranial bones, and they're also called sesamoid bones. They're small variable bones found embedded in the tendons where pressure exists. The axial skeleton. There are 28 of those, and they're subdivided into 3 categories, which is the cranium, the face, and the ear bones. Cranium, face, ear bones. The cranium has 8, so this is 8 of the 28, and it forms the cranial cavity that houses the brain. And that consists of the frontal bone, and it forms the forehead, the front, top of the cranium, and upper part of the eye socket. This frontal bone contains the supraorbital margins, which is the upper rim of the eye socket, the superciliary arches, which are elevations at and above the medial ends of the eyebrow, the glabella, which is a prominence just above the nasal bone between the medial ends of the eyebrows. Now that's a lot to be said. So an easy way to know your glabella is to point your finger, your index finger, put it in the middle of your eyes. So it's almost like you're cross-eyed, but you put that in the middle, right above your nose. That's your glabella. Your frontal eminences, the gently rounded prominences at the upper border of the forehead, and your frontal sinuses, they are cavities that communicate with the nasal passages. We also have the parietal bones. They form the majority of the upper sides and top of the cranium. Your temporal bones, they form the lower sides of the cranium surrounding the ears, and the temporal bones consist of the squama, which is an upper flat portion adjacent to the parietal bones, the inferior or petrous portion. It includes the hearing canal and houses tiny ear bones. Your zygomatic process, which is a projection on the temporal bone, and it extends forward anterior to the hearing canal to unite with the cheekbone. You have your mastoid process, which is a prominent projection on the inferior part of the temporal bone behind the ear. Your temporal bones continued. Your external auditory meatus, your hearing canal. Let's just call it your hearing canal. It's a tunnel in the temporal bone which extends medially from the external ear to the middle ear. And just remember, you always hear your hearing canal. People often refer to your hearing canal. It's in your ear. Your mandibular fossa, a depression on the temporal bone just anterior to the external auditory meatus, your hearing bone. Your hearing canal, not hearing bone, but hearing canal. And it articulates with the canal in the lower jaw. The carotid canal, a passageway in which the temporal bone, through which the internal carotid artery passes in taking blood to the brain. Your occipital bone. It makes up the lower back part of the cranium. So if you just pat your head in the back above your neck, you're hitting on that occipital bone. And it includes the foramen magnum, a large opening in the inferior portion of the occipital bone through which the spinal cord passes to connect the brain. Your occipital condyle is located on either side of the foramen magnum and articulates with the top bone of the spinal column. Your external occipital protuberance is the prominent tubercle on the posterior surface of the occipital bone. Now we'll talk about the sphenoid bone. And it is bat-shaped, so a way to remember it, it is bat-shaped. It looks just like a bat. And it helps make up the floor of the cranial cavity, the back of the eye sockets, and part of the temple area. And it includes the sella turcica. I may pronounce that incorrectly, but I am trying. And it's a depression in the center of the superior portion of the sphenoid and holds the pituitary gland. You also have your ethmoid bone, and it's an irregular shape which help make up the floor of the cranial cavity. So both of these help make up the floor of the cranial cavity, but this is part of the eye socket and the upper part of the nasal cavity. So that is the difference. This is the upper portion of the nasal, and this is part of the temporal. The ethmoid bone consists of the cribriform plate, which is flat, and it's a superior surface of the ethmoid involved in making up the floor of the cranial nasal cavity. The cristagalli, which is a rooster's comb because it favors the rooster, and it's the vertical projection on its superior portion. And your perpendicular plate, it's thin, flat plate of bone which extends down into the nasal cavity on the midline and helps make up the nasal septum. Now we'll talk about the face, which is 14 bones. So we have 14 and 8. The face consists of the nasal bone. There's 2 small bones we refer to as the bridge of the nose. So it's the bridge of the nose. The lacrimal bones, which is located in the anterior medial portion of the eye sockets. The vomer, which is in the middle, and it's in the base of the nasal cavity that helps form the nasal septum. Your zygomatic bones, which are your cheekbones. Your palatine bones, we refer to as your palate. So there are two small bones we refer as the roof of the mouth. So if you get your tongue and you hitting the top of your mouth, that's your palatine bone. Your maxillary bones or your maxilla, they are your upper jaw bones. And the maxillary bones consist of the alveolar process, which is part of the maxilla, and it roots the teeth, aka your gums. Your palatine bones form portions of the palate, lateral walls of the nasal cavity, and floors of the eye. Your mandible, which is your lower jawbone, and it includes the body, the ramus, the mental eminence, which is the tip of the chin, and the angle of the mandible, which is a point that's inferior of the body of the mandible, and it's turned upward. You also have your inferior nasal concha, which is a body ridge located on the lateral wall of the nasal cavity. And here we have a picture of the face, and you'll see it's been labeled, and you'll see right here's the mandible. Of course, you have your teeth, your maxilla, you have your gums, your occipital bone, your temporal bone, your parietal bone. Remember this part, you can hit the back of your head. Your frontal bone, forehead, sphenoid. This is your zygomatic bone, your ethmoid bone, your lacrimal bone, and your nasal bone. Remember, one is bat-shaped. Now we'll talk about the axoskeleton, and it's continued. Your auditory osseous, and these are additional bones outside of what we just taught. There are 3 pairs of tiny ear bones within the middle ear that are involved in transmitting vibrations that result when sound waves travel down the hearing canal and strike the eardrum. You have the malleus, the icus, and stapes. Now these are known for their shape. So you have a hammer, of course. Malleus probably resembles a hammer. Now we have the hyoid bone, a horseshoe-shaped bone located in the cervical region just above the voice box that serves as a point of attachment for muscles involved with movements in the tongue, mouth, and throat. The vertebrae, which are 26 bones, and it's in the spinal column that are arranged in a way which allows for strength, support, flexibility, and movement. This is the main support structure of the body, so your spine. Continued. Your vertebrae, and they're bones in the spinal column that are arranged in a way that allow for strength, support, flexibility, and movement. Again, the main support structure of the body is the spine, and it serves as a passageway for the spinal cord, which is the central component of the central nervous system, or CNS. It has 3 main groupings, which are the cervical vertebrae, and it's the upper 7 bones in the neck. The atlas, which is the most superior of these, and it's a CI, and it articulates with the occipital bone, and it's where the skull rests. And your axis, it's below the atlas C2. These are vertebrae, and it allows a pivoting action, enabling the head to turn from side to side. So it's when you're bobbing your head, dancing side to side. We'll continue to talk about the vertebrae, which is the thoracic vertebrae. It's 12 bones, and it's the upper back area that articulates with the pair of ribs. Your lumbar, 5 bones, and it's inferior to your thoracic vertebrae. Your sacrum, a bone resulting from the fusion of 5 separate vertebrae in a developing child that helps form the pelvis. Your coccus, tailbone, interesting. Thorax is a chest area, and it consists of your ribs, your sternum, breastbone. Your sternum, of course, your breastbone. It's a single bone with 3 segments. And your manubrium, your superior segment, body, middle segment, xiphoid process, which is an inferior segment. Continuing with the vertebrae, your ribs, there are 12 of them. And it consists of true ribs, which are the upper 7 pairs attached to the sternum, breastbone. Your false ribs, which are the bottom 5 that don't attach to the sternum, and your floating ribs, they have no anterior cartilage. They are ribs 11 and 12. We will move now to the appendicular skeleton. And the appendicular skeleton consists of 126 bones. And they include your upper extremities, lower extremities, your pectoral girdle, which consists of the scapulae, acromion, and coracoid process. Pectoral girdle also consists of the clavicles, which are your collarbones, and then we have the pelvic girdle. Now we'll talk about them. You have your head, which is the ball-like superior end of the humerus, which is your upper arm bone, and it attaches with the scapula to form the shoulder joint. Your glenoid cavity is a depression on the scapula into which the head of the humerus fits in order to form the shoulder joint. Your humerus condyles, they're inferior ends of the humerus that contain smooth, curved articular surfaces. Radius and ulna, in which we previously talked about in one of my shows. And of course, your radius is on the right side, your ulna is on the left. Of course, when you go to the doctor and they're trying to get your pulse, that's on your radius. And it attaches to the humerus condyle to form the elbow joint. Your olecranon process is the superior end of the ulna or elbow. Your carpals, 8 bones, they are your wrist bones attached to the ulna and radius. And for those who are in corporate professions that do a lot of typing, you often hear, if you do a lot of repetition on that, carpal tunnel. Yeah, they're those bones, the carpals, they're affected, and they're by your wrist, which is why you often have inflammation on that, and you have to get counseling or therapy or whatever it may be. Some people, if it's really bad, it turns into carpal tunnel and you have to get surgery. Then you have your metacarpals, which are 5 per hand, and they're bones of the hand. Your phalanges are 14 bones, and they're fingers, in which there are 3 bones in each finger with 2 in the thumb. So think about your fingers and how you have the lines on them, and you have 1, 2, and 3. Yes, those are your 3 bones, and you have 2 in your thumb. So those are your phalanges. And you have the proximal, middle, and distal phalanges. Then you have your oscoxa. And they are your hip bones that make up the pelvic girdle, and it's comprised of the ilium, which is the broad superior portion, the iliac crest, which is the upper rim, and your ischium, which is inferior portion. That's what we sit on, our butt. Sit on your ischium. So it's another word. We often say at work, BIC, which means butt in chairs. So if you want to do it, you can put ischium in chairs. Now your oxycosa continued, which consists of your pubis or pubic bone, and its inferior anterior segment just above the genital region. We know what that is. The acetabulum, which is a cup-like area into which the head of the upper leg bone fits to make up the hip joint, and your pelvis, which is the lower portion of the trunk between the abdomen and the thighs. Now, it consists of the false pelvis, which is the upper part of the pelvis above the hip joint, and your true pelvis, which is an inferior portion. Your femur, which is your thigh, large bone of the upper leg. And you also know when you're embalming, oftentimes we go through the femur to try to get distribution to the legs and the lower portion. You have your knee joint. It's made up of 2 condyles that attach to the lower leg bone from the inferior end of the femur. Your patella, your kneecap. And it's sometimes referred to as a sesamoid bone that's embedded in the tendon. Your tibia, which is your shin, and your tibial crest, which is a ridge on the anterior margin of the tibia. Your medial malleus, which is inside ankle bone, that's your inside ankle bone. Ever hit that or get a scratch on it, it feels like a funny bone. And it's the distal end of the tibia. Your lateral malleus, which is the outside ankle bone. Your tarsals, there are 7 in each ankle, but they make up the ankle area. And your calcaneus, which is your heel bone. You have your metatarsal, you have 5 in each foot. And they're the bones of the foot, and those just beyond the ankle. Your phalanges, of course, remember we had those in the hand, so you have 14 in each foot. They're your toes. One thing to note is over 1/4 of the bones in the body are phalanges, 56 of them. We'll look at the appendicular skeleton, your skull, your rib, spine. We just talked about those. Those are your axle. But these in blue are your appendicular skeleton, your phalanges, your metatarsals, your tarsals, your fibula, your tibia, your patella, kneecaps, your femur, your thigh. You see that? Pelvic girdle, radius, ulna, radius, that's your thumb over there. Carpal, wrist, metacarpal, your phalanges. And that would include today's presentation.